Autoimmune diseases are chronic conditions where our immune system, meant to fight infections and cancer, mistakenly attacks our healthy tissues. Over 5 million Indians are affected by over 150 autoimmune diseases, mostly women and young adults. Autoimmune diseases have genetic links and can be triggered due to stress, pollution, diet, or infections. But CAR T-cell therapy could reset the faulty immunity. What hope does it offer and how effective is it? Welcome to Second Opinion, where experts speak first. Autoimmune diseases are conditions where your body's immune system, which normally protects you by fighting off harmful invaders like viruses, bacteria, or cancer cells, mistakenly turns against your own healthy tissues and organs. Instead of defending you, it attacks your healthy cells as if they were foreign threats, leading to inflammation, damage, and a wide range of symptoms. Given the wide range of symptoms, early identification is difficult. Most common autoimmune disorders like lupus, rheumatoid arthritis, thyroid disorders, and psoriasis are rising, influenced by factors like pollution, stress, diet changes, and genetics in Indian populations.
The most common autoimmune disorders that we see here in our population is SLE, systemic lupus erythematosus, and followed by multiple other things, psoriasis, rheumatoid arthritis, inflammatory bowel disease, and some autoimmune disorders of the skin, like pemphigus. So there are many-fold, but these are some of the common disorders, the systemic sclerosis, Sjogren's disease. These are the diseases that we, as a clinician, we commonly see in clinical practice.
Symptoms often vague at first, such as joint pain, fatigue, rashes, dry eyes or mouth, and diagnosis can take up to 3 to 4 months. But untreated or uncontrolled disease can lead to chronic damage to kidneys, lungs, heart, brain, joints, leading to deformities, infections, and repeated hospitalizations.
Definitely autoimmune disorders, like for a general layman or for a general clinician, we say we can classify into mild, moderate, and severe. That is how we put most of our diseases. For each of these autoimmune diseases, we have certain disease-specific risk scores. So usually for most of the mild disease, we don't require actual intervention. But when it slightly crosses the border from mild to moderate, or we have some other indicators of the disease, either on the genetic test backgrounds or on the autoimmune serological tests that we do, if we identify that this disease is going to behave severe in the future, those diseases require intervention at that point of time. We call it as immunomodulation or immunosuppression. Because if we don't control the disease at that point of time, the serial organ damage will keep on happening. So our important organs are, as you all know, heart is there, lung is there, kidneys are there, brain is there, the gut is there. So each organ will have one tolerability, one threshold capacity to, suffer a certain amount of damage. But once it crosses that damage, it becomes a chronic organ damage, which we don't want.
Today, a revolutionary treatment, originally from cancer care, is giving new hope to millions battling autoimmune diseases like lupus, rheumatoid arthritis, and more. These conditions turn your own immune system against you. No cure, just lifelong medications with side effects, but CAR T-cell therapy could reset your faulty immunity. There are steroids, immunosuppressants, biologics, and other options for treatment, but they suppress the whole immune system, risking infections, and many patients don't respond lifelong or need lifelong pills. But what if we could precisely eliminate the rogue cells driving this without broad suppression? This is where CAR T-cell therapy offers hope. The process begins by collecting the patient's T lymphocyte, which is a type of white blood cell crucial for immunity, through a blood draw procedure called leukapheresis. These T cells are then sent to a specialized lab where they are cultured in a sterile environment and genetically engineered to express a chimeric antigen receptor. This modification enables the T cells to specifically recognize and target CD19, a protein found on the surface of B cells, the dysregulated immune cells that produce harmful antibodies in conditions like lupus.
So take the patient's T lymphocytes. you tune it in such a way that it fights the cancer or it fights the autoimmunity, so that the patient does not need more immunosuppressive medications. So the T cells, to put it very simple, we are trying to strengthen our immunity by fine-tuning our own T cells to fight these diseases. So to put it even more simple, so we are trying to harvest our own immunity to get ourselves better. But is the process very easy? No, it is not. T cells to fight these diseases. So what we have to do is we have to harvest the lymphocytes, make sure they are cultured in an appropriate sterile environment. They are tuned to fight the diseases that we want to fight. For example, blood cancer, acute lymphoblastic leukemia, or multiple sclerosis, or some refractory autoimmune condition. So for that needs a lot of cost and needs a lot of expertise. It is not that CAR T cell therapy is very simple and an easy process, but it with experts involved in it and with doctors who know what they are doing and who are experts in transplant, this can definitely be a safe and one-time option which can help in controlling most of these diseases.
Many patients achieve significant remission, often reducing their reliance on multiple immunosuppressants to just one or none, offering what could be considered a functional cure with improved quality of life. Side effects such as cytokine release syndrome or neurotoxicity are now typically minuscule or far milder than those seen in cancer applications, with recent trials reporting no severe grade 4 toxicities in most cases.
Right now, according to data and even theoretically also, it has proven worth in SLE, inflammatory myositis. And recently, the Chinese have come up with CAR T cell therapy for autoimmune hemolytic anemia also. So that is something really interesting to look at, right? So these three are the major disorders where published papers are there. Apart from that, you can find some minor indications in inflammatory bowel disease, skin disorders, autoimmune skin disorders. We can have data here and there, but predominantly the papers are in systemic sclerosis, inflammatory myositis, Sjogren's syndrome, and systemic sclerosis.
CAR T cell therapy isn't here for everyone yet. While the therapy requires significant experts, specialized facilities, and comes at a higher cost, it represents a potentially safe, less time-consuming option for carefully selected patients with experts managing the process. It offers hope as it is precise and immune-resetting treatment that could help millions of people. That's all for this episode of Second Opinion.